Good morning, everyone. Welcome to today's live update. I'm Chancellor Donde Plowman. Last week, we started implementing our comprehensive testing strategy, which includes new tools like wastewater testing and pooled saliva result tests. Today, I have with me Dr. Deborah Crawford, our new Vice Chancellor for Research, and we're going to take a deep dive into how this testing regimen is working, some early results, and how we're going to be using it as we go forward in the months ahead. As always, I have with me Provost John Somchuk and Dr. Spencer Gregg, who directs our health center. So let's start with today's data. As a reminder, this information is on our website and it's updated every day. This morning's numbers reflect the numbers that we had as of last night. So what you see here is we currently have 178 active positive COVID-19 cases. 178, so that line has sharply dropped. 166 of those are students, 12 are employees. Today's totals include 196 new recoveries that we subtracted out. That's people who've been 10 days and are now well. And it also includes 10 new active cases reported since yesterday. We now have, as the next slide shows, 849 people in quarantine, self-isolation. Of those, 771 are students. So again, that line is coming down. That looks like good news to me. I want to turn now to Dr. Gregg and get his take on the numbers. What are you seeing in the numbers, Dr. Gregg, that you see today?
Thank you, Chancellor. I'm glad to be with you again this morning. We are continuing to see a decrease in our overall active case numbers and an increase in our recoveries. And there's two ways to look at that. From an encouraging standpoint, our total number of active cases are declining, the recoveries are improving, and that would be obviously good news. But another interpretation could be that fewer people are choosing to be tested. So what we actually could be seeing is a decline in the cases due to our expected recoveries, in combination with fewer individuals being diagnosed as infected or identified as close contacts because fewer of them are being tested. As we had said last week, the latter interpretation is a little more likely to be the case because we're also seeing that statewide that the numbers of those being tested are starting to decline. The decrease in testing is concerning, especially for our college-age population. Because this population is more likely to exhibit minimal or no symptoms, without a confirmed diagnosis, they're less likely to change their day-to-day activities. And by continuing to be out in the community, they're more likely to spread infection to others. This places those who are more likely to suffer severe, potentially life-threatening complications at greater risk of exposure, and in turn can result in a greater number of hospitalizations and even deaths. We all need to take the lead on doing the right things, like staying home when we feel ill, participating in testing efforts, reporting when we know that we're a close contact with someone that's infected, timely completion of the self-isolation forms, and adhering to health and safety guidance on protecting ourselves as well as others. Our community, especially those at greatest risk of complications and even death, are relying on all of us to stay safe. During this public health emergency, all vols can demonstrate the importance of placing the safety of others first. At this time, many are doing so, and we commend them for their efforts. Some of our improvement in our numbers are likely due to this. We encourage others to follow their lead.
Thank you. And Dr. Gregg, that's so consistent with last week we had Dr. Deborah Burks here from the White House, and she talked about the decline in testing is something that concerned her. She also was very supportive of our new testing strategy, which we're going to talk about in a minute. So yes, numbers coming down is a good thing. We also are going to hear a little bit from our initial results on testing that we know the virus is on our campus. And so I just want to reiterate again, we need everyone to participate in the testing, and students are going to receive assignments depending on where they live, and you're going to hear a little bit more about that as we get to what we're talking about in testing. So we're moving to a new kind of testing. We're adding a new kind of testing, and you'll hear more about that. Dr. Greg, let's talk about what are the contact tracers seeing? Are we hearing anything different, or what are they saying right now?
Well, this week, very similar to last week, our greatest number of positive cases and their identified close contacts are not occurring in controlled settings like the classroom. Most positive cases and close contacts are resulting from activities related to social circles like group gatherings and having meals together, and in residential settings as well. And this holds true for students, faculty, and staff. We suspect many are still failing to submit self-isolation forms as needed. When self-isolation forms are completed, many are submitted still with delays of a few days, like after someone has already been symptomatic for a while, or after they've already been tested several days prior. So like they're telling us that, yeah, 4 days ago, I tested positive. And since the window to do your best, get the best information from contact tracing is during that first 24 to 72 hours when someone develops symptoms or gets tested, those delays in reporting to us are really closing the door of opportunities to prevent spread on campus. We'd really like to see that dynamic change.
So that's really important, that as soon, I've reiterated before, as soon as a student feels anything that's one of the symptoms, even though they might normally explain it as allergies, go get tested. And if they have been tested, immediately let us know. Partly because a big factor is it closes the window on the spread. It also triggers the services we can provide students when they're in isolation. And we've got a well-coordinated kind of rolling out a new service approach. And we need to know who you are right away, because we have people who can help you with almost anything you need help on while you're in isolation. So that's really important. Let's just reiterate that again. Let us know right away if you have symptoms or you tested positive by filling out the daily app and by filling out the self-isolation form. And as soon as you feel something that doesn't feel normal, go to the health center. Lastly, Dr. Greg, now we're going to get a deep dive here with Vice Chancellor Crawford on our new testing strategy. You know all about it. What do you expect to see in the coming weeks in terms of our positive cases and that kind of thing?
Well, I'm incredibly grateful for the efforts of Dr. Crawford and the other researchers in helping us to address the needs of our campus. As our comprehensive campus-wide testing is introduced under her direction, I suspect we'll see a greater positivity rate on campus, but by knowing where the rates are highest, we can then focus resources such as education and targeted testing on the areas that have the greatest need. The key to the success of our testing will be community-wide involvement. So I hope everybody on campus is willing to step up and participate.
Thank you so much. So before we move on to talk with Dr. Crawford about our testing program, I want to update everyone on the academic calendar, which we did talk about last week. We've had to make an adjustment to that. And so we're fortunate to have Provost Zomchik here who can fill us in on those details. So Provost Zomchik, talk to us a little bit about the calendar and where we stand today.
I will. Thank you, Chancellor Plowman. So when we were putting together the calendar, we inadvertently left out an entire week of instruction. So publishing a corrected calendar with the correct ending date for the semester, which is April 28th, 2021. So the correct ending date, which is the only date that changes, will be April 28th, 2021. April 29th will be a study day, and the final exam period will run on April 30th and from May 3rd to 6th. The correction to the spring calendar does not affect the start dates for mini-term and summer session. Mini-term will still begin on May 10th, and summer session, both the first session and the full session, will begin on June the 1st. So that information will be going out to the campus community a little later today.
Thank you so much. So now I want to welcome Vice Chancellor Deborah Crawford to her very first live update. Dr. Crawford joined us in her new role August 1st, and we're really, really excited to have her here. She's got an incredible record as a scientist, as a researcher, and as a leader on different campuses. So Dr. Crawford, thank you for being here. So let me just talk for a minute. Dr. Crawford is leading our systematic testing efforts, and her input and guidance has been just a tremendous asset to our leadership team. So to recap our conversation last week, we've added 2 new testing strategies to our repertoire: wastewater testing and pooled saliva testing. These new test capabilities complement our PCR testing, which is the nasal swab, the nasal swab test that tells us whether an individual is positive for COVID. Our student health center has been doing a lot of nasal swab tests, and I really appreciate their work in testing and treating students. So, Dr. Crawford, let's turn to you. Last week, we started our wastewater samples. First of all, what is that, and what have we seen in the results so far?
Thank you, Chancellor Plowman, and thank you for the kind welcome. I'm just delighted to have joined the UT community this last month. Let me start by providing a little background about our wastewater testing. Dr. Terry Hazen, a faculty member in the Tico College of Engineering and our Governor's Chair for Environmental Biotechnology, and his team are leading our wastewater testing efforts. They collect wastewater samples from facilities on campus and analyze them in their lab for traces of the virus, because it turns out that individuals who have COVID-19 shed fragments of the virus gastrointestinally in their feces. In the first full week of testing last week, Dr. Hazen and his team did detect traces of the virus in wastewater in some of our campus residential facilities. This wasn't surprising to us for several reasons. Number one, we already have students who've been diagnosed with the disease isolating in place in some of these facilities, and so we'd expect to find traces of the virus in those locations. Number two, there's some evidence from wastewater studies done in other parts of the country that even when individuals have recovered from the disease and are no longer infectious, they continue to shed virus fragments gastrointestinally for a period of time. And of course, we have a number of students, as you just all heard, who've recovered from COVID-19 recently and have returned to their campus residences. Dr. Hazen and his team are back at our residential facilities this week and will be there every week for the remainder of the semester. They'll continue taking wastewater samples to see if it helps us predict spikes in disease prevalence, and taking a long view, they'll help us understand when we're no longer able to detect traces of the virus in any of our campus wastewater.
Great. So that work really helps give us a picture at sort of a 20,000-foot level of what's going on in a community health sense on our campus, right? And looking at trends over time, as you just said, maybe helping us predict another spike like we've had so far. So, okay, so that's one type of testing we're doing. We're doing another one, which is this pooled saliva test. Sounds kind of weird. What is this test, and why is it an important component in addition to the wastewater monitoring?
So yes, wastewater testing is just one of the tools in our testing toolbox, and it's a fairly blunt instrument. Just now, it tells us whether there are traces of the virus in wastewater or not. It isn't yet able to help us understand what percentage of our community broadly or how many specific individuals may actually have active cases of the disease. Pooled saliva testing helps us estimate what percentage of the sampled population is positive for the disease. To provide a sample, you simply spit in a tube first thing in the morning before you eat, drink, or brush your teeth. So sample collection is much easier and less invasive than the nasal swab test that we've become familiar with over the last 6 months. Our pooled saliva testing strategy has been developed by Dr. Frank Loeffler, a faculty member in the College of Arts and Sciences and the Tico College of Engineering, and our Governor's Chair for Microbiology, as well as by his colleague, Dr. Albrecht von Arnim, Director of our Genome Science and Technology Program, which is also in the College of Arts and Sciences. Their testing begins in earnest later this week, when we'll collect saliva samples from all residents in Hess and Whitehalls. We plan to extend our saliva testing to more dorm and other university communities in the coming weeks and for the remainder of the semester. Now, in addition to helping us understand disease prevalence, the results of our community saliva testing also help Dr. Gregg and his student health center colleagues understand where they should focus their nasal swab testing efforts to identify specific individuals who have the disease. So taken together, results from all of our testing strategies, wastewater, pooled saliva, nasal swab testing, and our contact tracing efforts help us better understand and manage the health of our university community, and they inform the design and implementation of interventions that we make to mitigate virus transmission.
So this really kind of three-pronged approach to testing was what we discussed with Dr. Burks last week, and which she was very affirming about that. And so thank you for explaining that. They'll be busy over in those two dorms later this week, collecting those samples from everyone. So we encourage the students, follow the directions. You'll receive packets and directions about exactly what to do. And we thank you in advance for your role in this, your participation. Now, the third set of research I'm really excited about that you're overseeing also related to the COVID is, I know that we have researchers from our faculty and our community teaming up with faculty at the University of Kentucky to do a study about quarantined students. Now, our goal is to collect enough data to hopefully be able to shorten the amount of time a student has to stay in quarantine. The quarantine is 14 days, and that's been a real frustration for students and for, I think, most universities in figuring out how to deal with that. So, Dr. Crawford, what is this study about and how will it work?
So as you said, Chancellor Plowman, at the moment, CDC guidance requires that individuals who've been a close contact of someone diagnosed with COVID-19 quarantine for 14 days. So even if an individual tests negative for the disease or feels healthy, the CDC advises that they quarantine for that 14-day period, because the current assumption is that symptoms may appear anytime up to 14 days after exposure to the virus. We're joining with colleagues at the University of Kentucky to study whether, in fact, a 14-day quarantine period is necessary. We'll ask some of our students who are in quarantine to participate in a study in which they agree to provide nasal swab samples at days 3, 5, 7, 10, and 14 in their quarantine periods. If our study with the University of Kentucky and others elsewhere provide evidence that the positive cases that develop in individuals in quarantine are identified, for example, in the first 7 days of quarantine, the CDC may reduce the recommended quarantine duration.
So I'm excited about this. This was a challenge actually Dr. Burks gave us. I know she gave it to University of Kentucky as well, needing more data points. The original study that the 14-day guideline came from was a small number of people. And so she really encouraged us to work on this. And so we might have a role, we were playing a role in hopefully revising that guideline. So thank you very much for that. So effective testing is critical to helping us manage the spread of this virus and ultimately maintaining an on-campus experience for our students. We also want to be able to lift the restrictions for our students that we put in place a little over a week ago, but we need a picture of what's going on to make informed decisions, and we're beginning to get some data points. This will take everyone's cooperation, and I thank everyone for what you're doing. We're making good progress. This testing is going to be really important to us knowing where we are with the virus and what planning we need to do going forward. So in addition to individual PCR testing being done by the Student Health Center, a lot of this systematic testing is being done by our faculty and graduate students. It's a tremendous privilege to be part of a large research university where we have world-class scientists who can use their expertise and talents to help us understand and overcome these challenges. So thank you to the faculty involved and Dr. Crawford for your team and the work that you're doing. I've got a question for Dr. Zomchik, our provost. John, can you talk a little bit about the work of our faculty in this space at this very critical time in our institution's history?
Happy to do that. As Dr. Crawford mentioned, we have a number of faculty working under her direction who are directly trying to understand and help us combat COVID-19 and all the effects of COVID-19. We have faculty in our research intensive university working across many disciplines. So we've got surveillance testing, but I also want to emphasize that our discovery mission in general during this time continues in our laboratories, in our field work, in our studies throughout the community. So one specific example related to COVID, it can be found in our post-secondary education research center located in our College of Education, Health and Human Sciences, which is providing research not on a medical topic, but another very important topic about student engagement during the pandemic. As so many studies have shown, engaged students have greater chance of success and continuing on to graduation. So that the work that the PERC, the Post-Secondary Education Research Center, is doing helps us help our students during this challenging time for them. We've got other COVID-related work going on in our Baker Center. And Chancellor, as you know, the face shields that we distributed to our campus community were a collaboration between our College of Architecture and Design and the Tickle College of Engineering. But I also want to point out the fact that during these COVID times, during these pandemic times, our creative life goes on. Our printmaking program, our national printmaking program in the School of Art, Steve Prince, a visiting artist. And Mr. Prince's work can be seen by our community at the UT Downtown Gallery through this Friday. So our labs are humming with activity, socially distanced, of course. Our faculty are publishing their findings. For a research university like ours, it's essential that we keep these wheels of discovery and creativity turning, both to address the challenges that the pandemic brings to us, and also for the time afterwards as we turn our attention to continuing to contribute to the growth and the prosperity of our community, state, and nation. The faculty are doing during these really challenging times.
Thank you so much. And I keep right on my desk my own shield produced by our faculty members here and students, and couldn't be more grateful. They produced thousands and thousands. So I can't thank all our faculty enough for their hard work and their contributions. They're contributing in so many different ways, in and out of the classroom. I also want to thank our students who continue to follow the guidelines we've set out, and our staff who continue to do the work of supporting our students and our mission, and even the most unusual of times. Finally, we've had some updated information on the spring academic calendar since we discussed it last week, and I hope everyone took note of that. You'll be hearing more about it, seeing it in print and on the website. So thank you again for joining me today, and I will see you again on Friday's update. And go Vols.